This is Kenneth Hess with your Colfax News, and I am here today with
Jason Vitello
and
Max Gatz.
Tell me about what you guys are doing out here today, man.
So we are out here to promote an initiative called You Decide Denver. It's brought to you by the Public Health Institute at Denver Health and the Center for Addiction Medicine. We received a $100,000 donation from a private donor to help address substance use and addiction in Denver.
Amazing.
Yeah, and so we're basically, this person said, here's $100,000, and we want it to go to the community. And instead of the ideas coming from the top down, we want it from the people, from the bottom up. So what we're doing, we're having an event here today, and we're saying, hey, we want your ideas, and this money's going to go to you. You can go to You Decide Denver, search it on Google, look up You Decide Denver on the internet, and submit your idea that way. And we're just looking for ideas. You submit an idea, and then it gets voted on, and the top projects get funded from the $100,000.
Jason, so other than this amazing opportunity that you guys have been given, what other things does your organization do? What kind of services do you guys provide? And if people wanted or needed to get in contact with you guys to take advantage of this, how could they do that?
Right, so we are the Public Health Institute at Denver Health. And specifically I work in the Community Health Promotion Division. But the way I like to describe public health to people is with this analogy. Imagine there's a village and there's 100 people in the village. And there's a well in the middle of the village. And all 100 people drink from the well, and 99 of them get sick. Right? So you have the clinical approach or the medical approach where you get physicians in and you give people medicine to treat their illness. Public health is basically we want to know what's going on with that well, right? So we try to examine and address what is it that makes people sick to begin with, and what is it that makes and keeps them healthy, right? So we believe those are the social determinants of health, right? We believe that an individual's health or a community's health, even a society's health, is determined by far more than what happens within the doctor's office, right? It's determined by education, economic and employment opportunities. Is determined by access to healthcare and mental health care included, green space and so on, right? So in public health, we try to make sure that everyone, it's called equity. We try to ensure that everyone has the opportunities they need to be healthy and thrive.
I have a question for you guys. I don't know if you can answer this. If you cannot, that's okay. How has this new administration had an effect on your funding or on the things that you guys are able to do for community? I want to start with you on this.
So my scope is limited because I just work for You Decide Denver. I've been affected in other ways in terms of my benefits because I'm also on benefits outside of this for healthcare and things. But in terms of this work, it's pretty limited. I'll just say that, to go back to your previous question too, is that part of the way this program works, this project works, is it employs people that have lived experience with substance use to develop this whole process. So it doesn't just come from people that don't know what they're talking about. It's from people that have experienced addiction or alcoholism. And so it's a really cool way of incorporating that into the process of decision making, and so they get paid for their effort. So it's like people that have lived experience getting compensated, and it's helped a lot of people come out of some really tough places, including myself. And then they get to carry the project into the community, and then I'm sure he has some things to say too.
Yeah, the current administration has cut millions upon millions of dollars in public health funding, sadly, right? And this has not just impacted public health at the national and the federal level, but at the state and local levels as well. So funding cuts to chronic disease prevention, mental health promotion, maternal child health, you name it, right? And we're not even talking about, you know, controversial so-called DEI programming, but even like mental health programming for youth in rural communities. They've decimated public health funding, which has put a lot of our jobs and our programs in jeopardy, which is why You Decide Denver is so important, right? The idea is you know, if we're not going to get that money from the feds, we'll get it from the community, and the community will come up with our own solutions to address some of the biggest challenges